Nitrous oxide, N2O, is a short-acting anesthetic agent with a history of recreational use that predates its medical applications. Nitrous oxide has been reported as one of the most commonly used recreational substances. Mechanisms of toxicity. The toxicity of nitrous oxide relates to its ability to oxidize the cobalt ion within cobalamin, also known as vitamin B12. This oxidation renders cobalamin functionally inactive. The inactivation leads to a reduction in methionine synthase activity, which prevents the conversion of homocysteine to methionine, thereby reducing myelin production. Additionally, the inactivation of cobalamin reduces the activity of the mitochondrial enzyme methylmalonic mutase, leading to increased concentrations of methylmalonic acid, which can cause demyelination. Clinical presentations. Patients presenting with neurological abnormalities without an obvious cause should have nitrous oxide considered as a potential cause. Symptoms may include sensory deficits, either in a classic peripheral neuropathy pattern or with isolated areas of numbness or paresthesia. Motor deficits are classically described as predominantly affecting the lower limbs or involving issues with fine motor control. Other symptoms include ataxia, urinary retention, erectile dysfunction, and nonspecific symptoms such as confusion or personality changes, including low mood or irritability. Patients presenting with hematological abnormalities consistent with vitamin B12 deficiency should also have nitrous oxide considered as a potential cause. These abnormalities may include anemia, macrocytosis, agranulocytosis, or pancytopenia. Diagnosis. The majority of investigations focus on excluding other causes of neuropathy. It is important to understand that vitamin B12 levels may be normal even if cobalamin is not functional. Therefore, it is necessary to look for other indications of poor cobalamin function. Reduced function of methionine synthase leads to increased homocysteine levels, while reduced function of methylmalonic mutase leads to increased methylmalonic acid levels. Tests for homocysteine and methylmalonic acid should be taken prior to treatment in the emergency department, as they may take several days to return. If the patient is not being admitted, there should be a clear protocol for specialty ownership of these results. Management strategies. If a diagnosis of nitrous oxide toxicity is suspected, treatment should be initiated before the return of definitive diagnostic results. A suggested regime includes vitamin B12 1 mg intramuscularly once daily and folic acid 5 mg orally once daily. Hospital admission may be required depending on the severity of the presentation and the certainty of the diagnosis. Some emergency departments have established outpatient pathways for the care of these patients. If the patient can be safely discharged for follow-up, appropriate urgent follow-up within 7 days is suggested. Clear advice should be given to stop using nitrous oxide immediately and to return to the emergency department if there is any deterioration in symptoms. A method of administering intramuscular vitamin B12 injections should be provided, and patients may be trained in self-administration. An appropriate supply of medication to cover out-of-hours periods should also be provided. Patient education and harm reduction. Patient education is an opportunity to reduce future harms rather than stigmatize or criticize. Nitrous oxide, commonly known as laughing gas, is an anesthetic gas with pain-relieving and anti-anxiety properties. When inhaled, the gas rapidly dissolves into the bloodstream and reaches the brain within seconds. Effects include dizziness, euphoria, sound distortion, and hallucinations. Due to its anesthetic properties, coordination and awareness are strongly affected. The effects wear off within 2 minutes. Using a balloon is the least risky way to use nitrous oxide. Users should sit down away from hard edges and hazards to minimize the risk of injury from falling. Never attempt to fill a room, car, bag over someone's head, or any enclosed space with nitrous oxide, as this can lead to fatal oxygen starvation. Subacute combined degeneration of the spinal cord is a neurological condition caused by vitamin B12 deficiency. This condition leads to degeneration of the white matter in the spinal cord. Traditionally, It has been associated with malabsorption syndromes or pernicious anemia. However, nitrous oxide toxicity has emerged as a significant cause, particularly among recreational users. Nitrous oxide inactivates vitamin B12 by oxidizing its active form, leading to functional vitamin B12 deficiency even when serum levels appear normal. Symptoms of subacute combined degeneration. The symptoms of subacute combined degeneration due to nitrous oxide toxicity are similar to those caused by other forms of vitamin B12 deficiency, but may present more acutely. Patients often experience progressive numbness, weakness, spastic paresis, and ataxia. Sensory impairments include loss of vibratory and proprioceptive sensation. Neuropsychiatric symptoms such as confusion, irritability, or other cognitive changes are also common. A unique feature in cases related to nitrous oxide toxicity is that patients often report a history of recreational nitrous oxide inhalation or occupational exposure. Symptoms may develop rapidly after heavy use. Diagnosing subacute combined degeneration due to nitrous oxide toxicity involves several steps. A detailed patient history is critical. Clinicians should inquire about any recreational abuse or occupational exposure to nitrous oxide. Laboratory tests are essential. Serum vitamin B12 levels may be normal, but functional deficiency can be identified by elevated homocysteine and methylmalonic acid levels. Testing for intrinsic factor-blocking antibodies can help rule out pernicious anemia. Imaging studies are also important. Magnetic resonance imaging findings typically show hyperintensities in the dorsal columns and lateral corticospinal tracts of the spinal cord. Neurological examination often reveals hyperreflexia, spasticity, and sensory deficits. Management of subacute combined degeneration due to nitrous oxide toxicity includes several key steps. Immediate discontinuation of nitrous oxide use is essential to halt further progression. Vitamin B12 supplementation is required. High-dose intramuscular injections of vitamin B12 are administered at 1,000 micrograms daily for 1 week, followed by weekly doses for 1 month, and then monthly maintenance. Oral supplementation may be added for long-term management. Symptom monitoring and rehabilitation are necessary. Neurological symptoms may improve over weeks to months with treatment. Early intervention helps prevent permanent damage. Physical therapy may be required for motor recovery. Education and prevention are also important. Patients should be informed about the risks of recreational nitrous oxide use. Clinicians should remain vigilant for subacute combined degeneration in patients presenting with unexplained neurological symptoms and a history of substance abuse. Clinicians must consider nitrous oxide as a potential cause of neurological and hematological abnormalities. Early investigation and treatment are essential, even before definitive diagnostic results are available. Nitrous oxide-induced subacute combined degeneration is a preventable but potentially debilitating condition. Prompt recognition and treatment with vitamin B12 supplementation and cessation of nitrous oxide use are required.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.